Like many medical procedures, there's nothing glamorous about having a colonoscopy, but it's something that you should ultimately have because it could ultimately save your life. Joining me now is Dr. Rafal Barzak, and he is a colorectal surgeon at Midstate Medical Center. Thank you for joining us.
Thank you for having me.
Now, March is Colorectal Cancer Awareness Month, correct?
That is correct.
Okay, so it's a good time for you to be on the show here. So tell us a little bit about the trends in this type of cancer. You said that they've been decreasing in older adults, but increasing in younger adults.
Right, well, overall, colorectal cancer is the third most common cancer in the United States, but it is the second leading cause of cancer death in the United States. Overall, approximately 150,000 patients get diagnosed with colorectal cancer each year, and about 50,000 patients die because of the disease.
Okay. How many are not getting tested or getting a colonoscopy, and that could obviously lead to not a good outcome?
Right. It's a good question, and it is a continued struggle that we as healthcare professionals are facing. Not enough people do get screening. It is tough to estimate what is the percentage of patients who are getting screened, but we know that screening is overall lower, much lower than it should be, and many patients do not get screened because of a multitude of reasons. I think there is an overall anxiety about the procedure, right, and there is overall fear of the unknown.
Mm-hmm. Absolutely. But I mean, the process really isn't that difficult. I mean, I know you've had a lot of patients who might have been nervous going into it, but it's not as bad as what you think. I know some people who have colorectal cancer, and also people who, you know, my dad being one, always never wanting to go, and then you get to the point where you're like, hey, this could run in my family. I need to take action with this type of thing.
That's right. And, you know, it's the procedure itself is a procedure that's done under anesthesia, so you really don't feel anything during the procedure.
Okay.
The worst part about it is preparing for the colonoscopy, because it does require a preparation of the colon the day prior to colonoscopy to make sure that the colon is clean enough for evaluations.
But having one is so important, and I know you have a model here.
Yeah.
And so these are some of the things that we can prevent by having
Correct.
a colonoscopy.
So this is a miniature model of the colon, and it has multiple pathologies, but I will just focus on a couple. Colonoscopy requires basically a use of a long snake-like camera to go into the colon and inspect it carefully all the way around to detect abnormalities. And in prevention of colorectal cancer, what we're trying to do is we're trying to find polyps, which are little growths on the colon, on the inside surface of the colon, that can potentially turn into cancer. Not all polyps turn into cancer, but we can't identify necessarily which ones will. The larger the polyp, of course, the higher the chance of that polyp turning into cancer, and also of that polyp already containing cancer. And colonoscopy is a great tool because it doesn't only allow us to screen, but also allows us to treat those polyps by removing them at the time of the colonoscopy. And what we want to avoid is for that little bump to turn into something like this, which is an invasive cancer that requires surgery.
So it's more of a preventative measure, which is very important to have happen.
Absolutely. Absolutely.
And do you see more of this happening in men or women or at a specific age?
There's no difference between the sexes, but age is really the most important factor as far as colon cancer is concerned. Mm-hmm. But still, the older you are, the higher the chance that you will ultimately develop colon cancer. Okay. So 50 years of age is really the magic number. If you are otherwise healthy, do not have history of polyps yourself, or you don't have a family member, especially a first-degree relative member with polyps or cancer, then the screening should start at age 50.
Okay, very good. And of course, you can have that procedure done at Midstate Medical Center. You can see Doctor right here. And for more information, you can log on to their website. Thank you so much for being here, Doctor.
Thank you for having me.
We appreciate all of your information.